Hi, my name is Brendan. I'll be doing my presentation today on the impact of COVID-19 on nursing staff burnout. So, so this is the overview of the topic. There's 5 key points, and the first one being emotional exhaustion. The next one is increased workload, the emotional strain, the lack of resources, and the organizational changes. So, due to the intense demands of work during COVID, it led to feeling overwhelmed and tired. Uh, just long work hours and the increased workload. So instead of working 8s, you were working 12s, and there's a lot of patients to take care of. So there's limited breaks and the emotional strain. The emotional strain kind of ties into the lack of resources because you're stressing out about having the right PPE in order to keep yourself safe so you can go home to your family and not worry about getting anybody else sick. And your organizational challenges, the insufficient institutional support and communication leads to the struggle of not being able to communicate with your coworkers and kind of have somebody to talk to about the unfortunate events that are happening. These are quotes from a few of the articles that are all statistical. In other countries, like comparisons with how hard they work to save lives. So this is the importance of the topic based on statistics. They used in northern Spain, they used a convenience sample of 771 nurses working in hospitals, and this is all just based on the data burnout, demand, and resources at work. And a total of 32,000 nurses responded to the survey that asked about their professional needs. And nearly three-quarters reported that the primary concern was the lack of the right protective equipment. Throughout 16 different studies, including 18,935 nurses, met the inclusion criteria. Um, Based on the survey, 34% of nurses claimed emotional exhaustion, 12% claimed depersonalization, 15% claimed the lack of accomplishment and decreased social support, and the inability to cope with COVID-19 due to long shifts and lack of sleep. It could be argued that COVID-19 could be categorized as a new type of mass trauma. There's unique characteristics for the pandemic, but in this specific time and era, a lot of the students that were in school were actually pulled out of school and given jobs because the demand for nurses was so high. So the QSEN institution, which is the institution that like improves the quality and safety of healthcare systems, they were trying their hardest to train the nurses, but every nurse was just working already at that point in time. This is just a summary of the research findings. So, in Greece, the nurses actually describe how they were experiencing high levels of burnout, and it's just shown through emotional exhaustion due to the physical and mental demands of the job that they're in. And I mean, you have decreased social support and low family and colleagues readiness that's willing to cope with the new outbreak. These are key factors contributing to burnout. The burnout among nurses is linked to multiple factors, including high workload, fear of contracting infections, insufficient resources, and emotional stressors from the job. Um, as mentioned earlier, included in the workload, they were all working a substantial amount of hours, going in for 8s and having to work 12s, and then going home and sleeping for X amount of hours, and then coming in and doing the same thing over and over again. These are the complementary studies, so all the journal articles that I pretty much found, there's so many similarities in the, let's say, 50,000 or more surveyed nurses. All the articles pretty much just talk about the burnout and anxiety that was included and the lack of coping strategies that they obviously weren't aware of. And in the one article, it talks about the key stressors, which is the second one here, the safety implications of different forms. It just talks about the key stressors of patient loss and infection risk and the lack of recovery time leading to mental health and physical exhaustion. This is the thematic analysis of literature. So these are the main methods of understanding patterns. So stressors, it includes infection control challenges, shortages in staff, and intense patient loads. Physical and mental fatigue, so the combined demands lead to persistent exhaustion.
The burnout, high levels of emotional exhaustion, depersonalization, and reduced personal accomplishment are widespread. And resource gaps, the insufficient protective equipment and break opportunities amplify stress. Every nurse is in need for support. So in this time specifically calls for increased support um, where you sustain worker for their well-being and care quality. These are all examples of the coping mechanisms that can be used. So peer support, mindfulness and meditation, physical exercise, professional counseling, personal reflections, work-life balance. So um, the most highest recommended for severity-wise would be professional counseling. You just seek mental health resources and therapy. Physical exercise can engage in physical activities outside of work to relieve stress. And peer support, relying on colleagues for emotional support and shared experiences, allowing yourself to open up to others and talk about the situation that you might be stressing about. These are a couple questions that I kind of came across while doing my own research. So, did the research continue afterwards? So, the limited research on the long-term effects of burnout on nursing staff. So, the lack of longitudinal studies, the insufficient exploration of burnout among nurses who actually contracted COVID. So, this would be all the infected staff, and coping mechanisms, in which we just talked about a couple slides. So a need for deeper analysis of specific coping strategies used by the nursing staff themselves, and the diversity in experiences, a lack of studies addressing the varied experiences of nurses across different healthcare settings and regions, and the organizational support effects. So limited research pretty much just formed organizational support, which impacts burnout levels.
This slide just talks about the lack of continuing the studies. So they were only done during the events when COVID was the major time frame. So obviously you see a lot of the studies are done in 2020 and 2019, and none that were done in 2023, 2024. And the exploration of effective interventions, that could also be a way to track burnout levels over time, both obviously during and after, and then you could do the comparisons.
After this research, just realizing all the impact of all the nurses who were in the pandemic era, there's definitely a critical need for research on the long-term impact of the nurses themselves due to the stress and trauma that the pandemic caused. As mentioned before, the loss of patients and the isolation, everything that they went through to prevent getting others sick, and whether that was family or friends, it just caused isolation. These are just future research directions in case we ever encounter another pandemic similar to this, and the ability to cope and prepare ourselves would be much easier as we're aware of what's going to come. So the knowledge of mental health support programs for nurses would be a major thing to know and be resourceful, because focusing on that can tailor mental health to a more positive manner, and exploring the impact of a workplace environment modifications on burnout rates. In conclusion, the staff burnout was very critical in recognizing the burnout and the stressors caused not only supports nurses mentally or the mental health, but also ensures a higher quality of patient care. And as the healthcare landscape continues to evolve, the more that we prioritize the well-being of nursing staff through effective interventions, it'll be essential for sustaining a resilient workforce to make it capable of meeting the needs of patients and communities. It's essential to advocate for further research and proactive measures to support nurses, and by focusing on mental health resources and effective intervention strategies, we can foster a healthier work environment that not only enhances nurses' well-being, but also improves patient care. Our commitment to supporting nurse staff is a crucial step in ensuring the resilience of the healthcare system moving forward.